Hello, my name is Marianne Voigt, and today I'm going to discuss my research on musculoskeletal modeling to study the effects of how varying degrees of femoral anteversion impact the joint loads on the hip. Femoral anteversion is the inward torsion of the femur bone in the upper leg. Typically developing femoral anteversion ranges from approximately 12 to 20 degrees, while excessive femoral anteversion is considered to be 40 degrees or more. Due to changes in morphology, such as femoral anteversion, joint loads can vary. In addition to morphology, kinematics, such as gait patterns, and muscle activity patterns can affect joint loads as well. To characterize the dynamics of gait, motion analysis, surface electromyography, and musculoskeletal modeling enable the analysis of human movement to determine joint loads. Thus, I aim to answer the question, how do different degrees of femoral anteversion affect the joint loads of the hip in all plane directions? To begin the modeling process, the Rajagopal full body model was used as a baseline. The Madanese bone deformation tool was then applied through MATLAB and OpenSim to alter the geometry of the baseline model and create new models with femoral anteversion varying from 10 to 40 degrees. Finally, the 25 muscles that cross the hip joint were added to the model. From there, MoCo tracking inverse problems were run to estimate joint loads and forces created on the hip when walking. The simulations track the force throughout the stance phase of gait, which is the entire time in which the foot is in contact with the ground. After the simulations were run, the root mean square value of the joint loads in all plane directions were recorded. The root mean square value accounts for the accumulation of force over the entire stance phase of gait, not just at any one moment in time. The joint loads with varying degrees of femoral anteversion increased in the anterior-posterior and superior-inferior directions, while decreasing in the medial-lateral direction. In addition, it was found that the largest force value was in the superior-inferior direction. This makes sense with the study of gait, as walking is a motion conducted while standing upright. More simulations and studies must be done in the future to continue to understand the impact of varying degrees of femoral anteversion on the hip. This will be done using data collected from an ongoing study with subjects with femoral anteversion as well as typically developing subjects. The data will be collected using motion capture markers and surface electromyography sensors. Along with the data collection, there will also be a statistical analysis done to compare results and discover the significance of these findings. With that, my findings and ambitions have concluded. Thank you for your time and have a nice day.